LMUV program makes Saginaw quite different from the other MSU campuses. Besides having the built-in service component where we work on community projects and do community service on a weekly basis, we also have underserved components that are incorporated into our core clerkships. For example, during our family rotation, we do a rural rotation in rural cities in Michigan, where we work with patients and physicians in those communities. As part of our pediatric rotation, we also have the opportunity of working at an underserved clinic on the east side of Saginaw. Another component of the program is the international component, where we devote 8 weeks out of our third year and 4 weeks out of our fourth year to travel and provide care in countries like Peru, Costa Rica, and Uganda, and also do preventative health education there.
There are some differences in clerkships, like the way some of our clerkships are sort of set up, with an underserved focus in family medicine. We get to go on a rural rotation where other community campuses don't get to. So for 3 weeks we go to some community in the Thumb area, and we get to experience rural medicine with a family medicine physician. And for me, it was a wonderful experience. I had a great time. I was in a hospital in Gaylord, Michigan, where I was the only medical student, and I got to experience obstetrics and orthopedics prior to ever being exposed to surgery or obstetrics in my actual core clerkships. And all the physicians were amazing, and the fact that I was the only medical student, and they don't necessarily take that many medical students, people were very open to learning, of my learning and teaching me, and the experience overall was just totally wonderful. We also have another sort of addition into the pediatric rotation, in which we spend a week in an underserved clinic with Dr. Fasal, who's sort of an institution in Saginaw. It's interesting in the sense that there is actually a pretty obvious divide between where people live who don't have very much and where people live who do have quite a lot. And this clinic is in the community that is geographically and just when you drive through it, it's clearly underserved and economically impoverished. There's boarded up houses, there's a lot of social issues in that area. The Jane Street Clinic is in that community, it serves that community, it's for the people in that community. They have driving service for people to get to the clinic. They have a multidisciplinary office setting. They have obstetrics, psychiatry, family medicine, pediatrics.
Any clinician or any med student aspiring to be a clinician in any field, in any specialty, will find is that a lot of your population that you treat are underserved and vulnerable in a lot of ways. The difference between someone who goes through our program and anybody else is the fact that we specifically tailor our program to becoming a leader. So while someone who might not get this training will still treat and serve people who are in underserved and vulnerable locations, they won't have the training to be able to go out and go into communities, to create teams, to lead a team into a community with a specific objective, whether that's a health fair, whether that's screening programs or a research project. And we have the specific ability to do it in rural, in urban, and international. So you really get a flavor of each one of the settings and where you find underserved and vulnerable populations, and you learn how to become a leader in those aspects. Part of being a leader is taking on projects, adding responsibility. You're really carrying the torch instead of just waiting for the patient to come to you. You're going to the patient, you're going to the populations, and you're trying to figure out how to be proactive in serving those populations and figure out the best way to take care of them. So that's one of the reasons why the LMUV really sets it apart from just any other program that you might find. Growing up in Southern California, I've done a lot of work in Mexico, doing medical missions and things like that, and that's what actually got me into medicine. So I figured if I'm going to be doing that type of stuff, that's kind of my goal in practicing medicine, then I'm going to want to find a program and a place that can nurture that and bring me into becoming a leader in those aspects, putting teams together and things like that. I just found that it's something that I wanted to get into. It fit a lot of who I am as a person, my goals and my career, and it also gave me a lot of freedom too, to mold some of my research interests, my desire to do international work, and also figure out ways to be a better clinician at home too in the US.
Another reason why I applied to the LMUV program was because of the cultural aspect. And then by that I mean being able to work internationally and to work in this underserved area. I'm from a multicultural environment. I want to go back and work in a multicultural environment. And in the LMUV program I get to go abroad. I get to do that third year, I get to do that fourth year. And I want to learn about other cultures. And I think, even if I don't end up working with those specific cultures, I still develop an appreciation of things. And I want to be able to come back, know where another person's coming from, know their story. And as a physician, I think being able to know that information will be able to help me provide the best care possible.
The major thing is community project time, which I appreciate more than I thought I would, because coming into med school, I thought, dreams of grandeur, and there's so many things that I want to do, and I want to be involved in the community. That was something that I did prior to med school while I was in preclinicals, and also wanted to pursue later on and throughout my medical school training. But then you sort of hit clerkships and realize you don't really know very much, and you end up studying a lot, and everything kind of goes away. So the one thing I really love about this campus is that we are given the time to do, because your hours are so scattered on clerkships. So being in a campus that makes community service a priority is invaluable if that's something that you are committed to doing in your career as a physician. So that has definitely made this campus something that fits my sort of personality and the manner in which I want to pursue medicine and be a physician.
I really like Saginaw a lot better than I thought that I would. And honestly, I've never felt that it was an unfavorable place to live. I felt safe everywhere that I went. I found people from all different walks of life here. You find a little bit of everything. And it's been fun to be in the hospitals in a community where you find people who are from underserved areas who are able to then give you a broader experience.
Well, I'm originally from Oakland, California. I had a lot of anxiety moving here. But again, I think it's relative to where you're from. I grew up in I would consider a bad neighborhood, and when I arrived here, it wasn't the case at all. Not anything like where I'm from. Compared to my experience in East Lansing, which is a big college town, I felt like Saginaw was a much easier transition than when I first moved from California to Michigan. Embracing this community has been not that hard of an experience at all.
In a lot of ways, I like it better than the college towns that I grew up in and that I spent a lot of my college years in. It feels more homey. There's the rural side, you can get out into the fields outside the city, and there's an urban population as well. There's a good mix of people here, and then as far as just living here, I feel safe. I live in an apartment complex with a lot of other medical students and a lot of residents, and so it's a nice little community. We get time to spend and hang out together, we study together, and there's good places around that you can go to coffee shops and study. There's movies. If you like getting outdoors, you like the fishing, or you like riding bikes, just getting out, Saginaw has fostered a lot of outdoor activities, boating, and it's really a nice area. You're close to the thumb, you can go to Lansing, you can get down to Detroit, you're about an hour from everything. So in that way, you feel good about the opportunities you have here to hang out and do extracurricular activities, but it's also more of just a homey feel, and you feel safe, you feel comfortable, and overall a generally nice place to live.
The biggest thing for me is that we really do get to work with underserved populations. By living here in Saginaw, we've really immersed ourselves into the community, and we not only learn about the medical problems that afflict our patients, but also about the environmental and socioeconomic factors that affect our patients' health, and how those things contribute to their medical illnesses. Another thing I like about the program is that the students that are in the program, we all share the same goals and values. And it's nice to work with a group of students who really show devotion and compassion and work hard at really trying to provide quality care for patients in an underserved setting and really develop innovative programs to help patients in this community.
The LMUV program has been wonderful because it has made sure that we maintained our commitment to serving underserved populations. I think it would be really easy in medical school to lose sight of that focus because you have so many responsibilities that are pulling you in different directions for school and for personal life, and it would be really easy to get so involved in that you lost sight of the bigger picture. And I think LMUV program not only allows you to, or forces you to maintain that focus, but it gives you the specific time within your schedule to be able to keep it up. And I really enjoyed having that, especially the international pieces too, because that allowed you to get a different perspective on medicine once you were already here.
I'm working in Costa Rica, I'm working in Nicaragua. They taught me not only the differences between the American health system and the health systems used over there, but they also taught me how best to use the resources that are available. I mean, in Nicaragua, you're not working with a lot of resources. In Costa Rica, you're working with more resources, but still not as much compared to the United States. And as somebody that wants to work in an underserved community, I know that I can take what I learned over there and bring it to wherever I choose to work at here, and I think it'll make me a better physician that way.